Raymond, are you able to connect your internet and your audio?
The one that we have, that I have so far.
Yes. I'm able to connect now. I can hear you. It's okay now.
Great. Should we go ahead and get started?
Yes, we can get started now.
All right, let's go for it.
Good morning, everyone. My name is Chisena Kapungu, and I serve as Senior Gender and Youth Advisor for YouthPower Learning. We'd like to welcome you to the webinar entitled Increasing Men's and Boys' Access to HIV Prevention and Treatment in Zambia, Test and Treat Through Community Insakas. YouthPower Learning is a USAID-funded project which is focused on sharing and disseminating knowledge about positive youth development. When we talk about positive youth development, we're focused on, it's a philosophy and a strengths-based approach, which is focused on building the skills and assets and abilities of youth and leveraging those assets and their ability to contribute to the positive change for themselves and their communities, and with the support of their enabling environment. In terms of YouthPower, there are several opportunities to partner together. On our YouthPower website, we have a series called Identifying What Works, which provides effective strategies in certain sectors. We are also just recently released this year a Positive Youth Development Measurement Toolkit, which provides resources and tools to measure positive youth development. We're there on the website. There's also a range of resources, events, information, and youthpower.org serves as a learning hub. We also have 4 communities of practice which we welcome you to join. One is the Youth in Peace and Security, Gender and PYD, which is this one, Youth Engagement, and Cross-Sectorial Skills. And we also have ongoing Youth Power activities through our Youth Power projects. And several times this year, we have opportunities to apply for our grants under contracts. In terms of the Youth Power Learning, Gender and PYD community of practice, our aim as a community is to seek to support gender integration in youth-focused programming. I'm Chisena Kapungu, and I also work for the International Center for Research on Women, and our co-champion is Chelsea Ricker. She's an independent consultant for Making Sense International. And we also have facilitator Lindsay Wolf. This community of practice started in December of 2015, and right now we have over 480 members. So I'd like to introduce our presenter today. We're so happy to have Raymond Havwala. He serves as a male involvement specialist at Men Engage Zambia Alliance. Raymond is the founder of the Young Women's Christian Association Council of Zambia Men's Network, which he created in 2005. As YWCA Men's Network Coordinator, Raymond managed the Good Husband campaign and the I Care About Her program and provided technical support for the Boy to Men Project campaign and the Test and Start project. These projects engage men and boys in gender-based violence and HIV prevention. Currently, Raymond is a male involvement specialist on the Test and Start project with IntraHealth International. Today, Raymond will discuss strategies to increase men and boys' access to HIV prevention and treatment. Raymond, we look forward to your presentation. Thank you. You can start.
Thank you so much, and I am very happy to present on this topic, which is very passionate, and I've been a very passionate male involvement officer and specialist in our country, Zambia. And right now, I'm going to present this topic on increasing men and boys' access to HIV prevention and treatment through test and treat community. Insakas. And Insakas, this is a traditional name which is very common in my country, Zambia. And basically, Insaka, it is just a male meeting where you discuss quite a lot of issues, starting with men's health, boys' health, gender issues, gender-based violence, gender equality, and gender-based violence. So it is quite a platform of men where you discuss quite a lot of issues. So I am Raymond Havwala. I am the male involvement officer at Intra Health, where I'm implementing the test and start. So to begin this discussion, I just want to talk about the Main Engage Alliance. This alliance um, um, where main organizations and individuals take part to make sure that the male issues, prevention issues are coordinated through the Main Engage Alliance. So the Main Engage Alliance is an international network of civil society organizations working with men and boys for gender justice, promoting health, reducing violence by challenging structural barriers to women's rights and gender justice. So we believe that we work collectively and individually toward advancing our women's rights, gender equality, women's rights, and social justice. And the Men Engage Alliance is a global alliance, and our vision is a world where all people are equal and free from discrimination, and in which gender justice and human rights are protected and promoted. And the Main Engage Alliance's mission is the Main Engage Global Alliance works to transform an equal power relations and patriarchal system by addressing the masculinities and also building inclusive alliances from local and region and to global. We're also working with men and boys through intersectional feminist approach and fostering joint actions in partnering with women's rights, gender, and other social movement. And in our country, Zambia, the alliance is also strong, and we are also addressing the above issues. That on the global means the Main Engage Alliance. So I'll now talk about the test and start. The test and start is a CDC funded project, which is basically funded by PEPFAR. And IntraHealth is implementing the test and start in Zambia. And the test and start target a group that is men who are identified as possible partners of adolescent girls and young women. So IntraHealth basically is targeting the boys between the ages of 15 to 19, and also it's targeting men between the ages of 20 to 29, and these are identified as possible partners. And just to explain a bit more about these possible partners to adolescent girls and young women, IntraHealth is implementing the Dreams project, which is targeting the girls in between the ages of 10 to 24. And this project basically is making sure that the girls who are resilient, empowered, and also in terms of AIDS free and mentored, safe. So the girls have so much information, but the gap that we identified was this, that their partners to these girls, they were not a target group on the Dreams project. Hence, to formulate or to have an intervention that would directly engage the men and boys, so that in as much as the girls are learning, also the boys could be engaged on issues to do with HIV and AIDS in terms of testing, in terms of HIV prevention, and in terms of HIV treatment. So the project activities uh, they are synergized with the HIV testing project and counseling and Dreams project, which also IntraHealth is implementing in various communities. So the test and start plays a complementary role where we are just targeting the males in between the age groups, which I talked about above. And the test and start project objectives, we have four objectives that we currently have. The first objective is to provide HIV testing and counseling with a focus on men who are partners of adolescent girls and young women and refer them for services. I'm going to talk more about the services in the next slides that I will refer these men and boys. And the second objective is to implement strategies to ensure men who test either HIV positive or HIV negative, they are linked to appropriate follow-up on HIV prevention, HIV care, and HIV services. So we make sure that those ones that are positive, they are linked to care. Those ones that are negative, they are linked to appropriate prevention messages. I'm going to talk about more. And then the third objective is to implement strategies to ensure community adherence for HIV positive men who are on art. In our country, this is quite a big problem where most of the men that test HIV positive, they would not stay in terms of treatment, in terms of the adherence. So we had to take this to the community where the men are. So we had to come up with strategies that will make sure that these men they adhere, the men that are HIV positive, the boys that are HIV positive, uh, are on act and they stay on adherence through the community adherence program that we are implementing under IntraHealth. And also the fourth and the last objective is to implement strategies to ensure effective follow-up and tracking of clients are reluctant to test or enroll in art, including home visits and phone contacts. So we have to make sure that those men that are reluctant to test, those men that are reluctant to enroll on art, we have strategies that will make sure that we visit them in terms of home visit. We make sure that we have information of their contacts at their homes so that the community activists, which I'm going to talk about in the next slide, they follow up to make sure that they adhere on art and also on testing. And we have the strategy in terms of this test and start community intervention is contributing towards achieving the UNAIDS target of 90 people living with HIV should know their status. So we are contributing to that 90. We are also contributing to the second 90 of the 90% of people that are living with HIV are on treatment or they remain on treatment, they initiated on treatment. And we are also contributing to the third 90, which are 90% of the people that are on treatment, their viral load is suppressed. So we are making sure that we have these strategies, but with the focus on men who are possible partners to adolescent girls and also the partners to the adolescent girls. So in working towards the 90-90-90, our strategy has been first and foremost to build capacity of community activists. We call community activists at a community level, and these community activists, they are people that have been identified within the communities, and they live and work within those communities with the help of the health facilities. These people have been identified and we provided them with training. So what we have done is this training is a 5 days training where we're using the HIM approach or the images of the health images of manhood approach, where we train them in the four things that I will talk about in the next slide. And these men they recruit other men within their communities, other men and boys within the communities, and the recruitment is done in such a way that it is targeted. It is targeted in the sense that in trying to achieve the first 90 of the 90% of the people, living with HIV to know their status, we've made sure that the recruitment is done targeting those people in the hotspots, in the areas where we strongly feel that there are men with risk behaviors and the men are recruited from those areas. And then those ones that are recruited, we make sure that they join the Insaka meetings. And just like I talked about the Insaka meetings, these are meetings where it's only the men who attend these Insaka meetings. And we also have the boys separately who attend these meetings. So these are permanent groups, and these are permanent groups that meet for a period of for a period of 6 to 8 months, and we use different topics, to make sure that they begin to test, and those ones that are positive, they begin treatment, and those ones that begin treatment, they stay on treatment, uh, or they adhere to treatment, and those ones that are negative, we make sure that they are referred for HIV prevention messages. So through the Insaka meetings, the men that attend these meetings, we make sure that those ones that are ready to test on a separate date, we on a separate date, we conduct what we call a mobile HIV testing and counseling. So the Insaka is a platform where they will make a decision to test. And when they make that decision to test on a separate date, we support the health facility that travel to where the men are, so that they are tested, they're HIV tested, and also cancelled. And those ones that are positive, they are immediately enrolled on ART. And because this is a test and start, our strategy is this: that when they test positive, they are immediately initiated on ART. And those ones that test are negative, they are referred for voluntary medical circumcision and other services. And both the negative men and then both the negative and the positive men, they continue meeting through the Insaka meetings. And those ones that are positive, we make sure that there's a community ART adherence program where information is shared amongst themselves, and we give them the benefits of being or remaining on ART. So the health images of manhood approach that we are using, first and foremost, we build the skills to improve men and boys' practical skills in interpersonal communication to access health information and services. There is a huge gap here because most of the men in our country, I don't know about in other countries, but in our country, Zambia, most of the men, they don't have so much information on health and health services. So during the training of the community activists, we emphasize that the men that are recruited, they are given this information, and also they are also given information where they can get the treatment. They are also given the skills to make sure that they begin to communicate properly. And also we also transfer the practical skills, the interpersonal skills to communicate. And it is those skills that we hope that is going to lead to behaviors where we engage men in addressing responsible sexual behaviors and HIV prevention, care, treatment, and emphasize on the importance of their involvement, because we believe that engaging men at engaging men at a community level, and to emphasize their participation and also their behaviors, the positive behaviors, for them to begin, to test, for them to begin to take part in HIV prevention activities like the monthly Insakas or the main Insakas, and also those ones that are HIV positive, to make sure that they are put on care and on treatment. So it is very, very important, and those behaviors, they resonate in the minds of the men that attend the monthly Insakas, so that they can begin to have a positive behavior. And it is the positive behavior that will make sure that they access the treatment, they access the health care, and they begin to test. And the third wheel under the health measures of manhood, which is the HIM approach, is to increase the knowledge, to increase men, stroke boys' knowledge in community, especially in reproductive health and family planning, sexual transmitted infection, and HIV. So we give this information to the men so that they can know the consequences of not taking part in reproductive health, not taking part in family planning, not really protecting themselves in sexually transmitted infections, and also on HIV, so that that information which they have, they can positively use it to prevent HIV, and also to be on treatment, and also on care, and be initiated on it. And the last one is on attitude and awareness. We believe in our country that the men's attitude, the men's attitude and negative cultural norms and gender stereotypes on health and behaviors is what puts them at risk, and also puts their partners on a risk. So the HIM approach has topics to make sure that men increase men and boys awareness on effects and negative cultural norms and gender stereotypes on health, so that when they have a good positive, when they have a good cultural norms, good gender norms, when they begin to stop being stereotypes on health, and when they have good behaviors, then they are going to begin to test, they'll begin to access treatment, and they'll begin to make sure that HIV is prevented through working with men and boys. So this is just a summary of what the HIM approach, how we are using the HIM approach in working with men and boys to make sure that they access treatment and prevent HIV. And further, we have a process that we have in place. And this process, first and foremost, just like I mentioned much earlier, that we have community activists who are identified through a health facility lead. So deliberately, this project is attached to the health facility or to a clinic, to a hospital, because that is around the communities where we are working, and we have done that so that we can better refer the men, and we can also support the health facility to carry out mobile HIV testing and mobile ART and adherence programs. So the facility has a health staffs that a lead on the test and start, and these are health staff lead are the people that help to identify the volunteers within the hospital, the male volunteers, because we are using the peer approach, the male volunteers within the facility, and these are the people that we facilitated with the HIM approach training, which is a gender approach in tackling HIV and treatment. And then we also engaged the mobilizers, and these mobilizers were very key to make sure that we identified the partners to the girls. So the mobilizers to the partners, they made sure that they engaged the girls on the Dreams project, and they gave us, or they gave them the names of their partners, and it is the names of their partners that we compiled a list of their partners, and then we invited them to be part and parcel of this Insaka or the men's meeting or men's group within their community. And also the potential partners, we engaged the club DJs and these club DJs, because we believe that in terms of the saturation or where the hot spots where drinking places where men are found. And so we engaged musicians, we engaged club DJs. We also engaged female, for a lack of a better term, sex workers who work in those places as mobilizers to mobilize their clients, their partners, because those were the men and boys we were very much interested to make sure that we do encourage them to begin to test. And the second, in terms of the process, using the hymn or the images, the health images of manhood approach, we made sure that the mobilized men, they began to HIV to test, to begin to access the accessing the health care within their communities. And the third process that we had was to engage the, just like I mentioned, the boys and boys who are likely to be the adolescent girls partners, and who are considered to be at the risk behaviors. And then we formed the Insaka meetings, and then the discussion groups using the HIM approach, which are guided. So the HIM approach, we have broken it into sessions using cards. As I continue to present, I will show you an example of a card that we use. So these cards, they have different topics, but what is very, very important on this card is this: that after each and every discussion, the men that attend these Insaka groups, they come up with their action plans. And the action plans, depending on the topic that was being discussed, they will go back home in their various homes to begin to practice what they learned during the Insaka discussion. So if the topic was on HIV testing, then the men will have to, those ones who decide, to test, they'll come up with an action plan on how they will begin to practice what they have learned using the cards. And that has been very effective way to make sure that it is not just knowledge, but they begin to practice what they learn. And the fourth process is this: that then those ones that make up their minds, they are referred for HIV testing, and those ones that are HIV positive, they immediately initiated on ART, and those ones that are HIV negative, we refer them for voluntary medical male circumcision, and also other messages to keep them negative. And then we continue with the Insaka discussion meetings for HIV prevention and treatment messages. And this is an example of the Insaka discussion card that we use, and we've made sure that we use information that is researched, and information that, when you communicate with to the men, that is going to add knowledge to them. So for example, this card is talking about important information. After all the discussions, we each and every discussion, we give the benefits of the test and start treatment, and we are using these results, and also the message from the executive director of UNAIDS, who commented that this is a breakthrough, and this breakthrough is a serious game changer. And just to, talking about the game changer, it gives hope for those ones that are on a risk behavior, to begin to make up their minds to test. And also just to say, and it will drive a prevention and revolution forward. So we are using this information also when we give it to the men, that, they are, wow, not everything is lost when we talk about being HIV positive, but there are, you can, when you begin treatment, there are benefits that are accrued when you begin treatment immediately. And this treatment, which we are saying treatment as a prevention, and we are talking about this, when they remain on treatment, and once they consistently remain on treatment, we are talking about their viral loads being suppressed to undetectable levels, and once that is reduced, they will not, the chances of them passing the virus to their partners, uh, it's reduced drastically. And we are also talking about the benefits of them not being, opportunistic infections, having their opportunistic infections attacking them. So that is also a benefit that that they will need to know. So just this card, when we began to administer this card, we noticed that there was a swing. There was the people, the men that started to make up their minds to test. There was just a shoot up, and also in our country, there are the new guidelines, the HIV testing and treatment guidelines talks about the men that are HIV positive to immediately being initiated on ART. So we have used that opportunity to educate the men through the Insaka meetings to make sure that they receive that information so that they can make up their minds to test, because it's the first thing that they need to do. So that is just an example of the discussion cards. So we have a total of 19 cards that are administered by community activists. And I will just give, so those strategies that we put in place will give you some statistics that we have since inception of the Test and Start project. So the achievements against the targets, that is, we started this project in February, and I'll give you the statistics up to February. So we had targeted to sensitize 7,262 men and boys, and we, for the whole period, for the whole 1 year, we are supposed to implement this project. I mean, from January up to February next year, 2018. So far, we have sensitized 8,088 men. So we are above, we're already above the target of 111%. So we've achieved our target, and this is just 6 months of implementation of this project. We were already above our target to sensitize. We also targeted to provide testing, HIV testing services to 2,967 men and boys for the whole period. That is February to February 2018. And as I am speaking to you, that last month, which is July, we have tested 2,282 men and boys. So, and so we are at 77% to achieve our target, and this is just 6 months to the project. And out of the 2,282 that we tested, we had planned to have 395 as HIV positives out of the total tested, or the total target. And right now, out of the 2,282 that we tested, we have 365 positives, which is at 92% to reach the target that we had planned to achieve up to the end of the project. And out of the 300, and we planned to initiate 395 positives on art, and we have so far initiated 285 men on art, which is 72%. That is for the whole period. But as I continue to make my presentation, you will discover that when we started in February, in February we were just mobilizing, and in March we were just also mobilizing. The testing and the sensitization started in April. And further, in terms of the positivity yield by month, we had 6% in April when we did the HIV testing, and in May we had 19%, and in June we had 34%, and in July, which is last month, we had 36% in terms of the positivity yield. So the numbers in terms of the positivity yield, they keep increasing. They keep increasing, and this is attributed to when we started to begin the information on the benefit of testing and on the benefit of treatment, and the number started increasing because most of the men with risk behaviors, they began to make up their minds to begin to test. In terms of the linkage on art from in the period of April to June, we have that is the quota from the intra-health point of view. Our quota is from April to June, that is 3 months. So for the last quarter, our linkage on art has been on 92%, and 92% of which we have exceeded by 2% on the UNAIDS target of 90% of the people living with HIV to be linked or to be initiated on treatment. In terms of our achievement on mobile, on VMMC, we referred 228 and for VMMC, and we also referred 212 for family planning, and all these males. In terms of project successes, our approach, first and foremost, the male Insakas structures were established with a strong link to health facilities. So these Insakas structures, which were established, we made sure that they are linked to health facilities so that at the end of the day, the men, they access the health services that they will need, and also the health staffs, they access the men for continued care. And also we simplified the Insaka conversation cards, the simplified Insaka conversation card developed and employed. So the HIM approach, we simplified them into discussion cards so that it is the conversation between the men and the community activists and the men. And that simplification of the cards were very, very effective to communicate the messages effectively. And also the establishment of a partnership with a community organization for complementary activities. For instance, VMMC, we have partners that are in the communities that are providing these services. Also, male partners of adolescent girls and young women mobilized through collaboration of the Dreams project. So we made sure that these projects synergized to a point where the partners of the girls are put on the test and start, and both the girls and the men are better informed on how to begin the treatment, how to prevent themselves. And also the index testing, where the partners of who test positive on the test and start, we've also made sure that there's index testing to their families, also their partners, or on the of the adolescent girls, so that they are also tested. So that has helped to make sure that the first 90 within the communities, we contribute to the first 90 And in terms of the key results that would want to share to this forum, one, we have the strong targeting of men at risk of HIV, as demonstrated by the increased HIV positivity yield month by month. In April, we had 6%. In May, we had 19%. In June, we had 34%, and in July, we had 36%. So there is that strong targeting that we have demonstrated through the test and stat, and also the strong linkage rate for HIV positive men in the last quarter where we are linked 92%. That is a key result that would want to talk about, because this result exceeds the 90% target of the UNAIDS goal. And also the improved retention among men, which have the improved retention among men, which has been low compared to their female counterparts. And when we talk about the female counterparts, we are talking about the adolescent girls that are on the Dreams project. Because of the strategies that we've employed on the test and start, there has been that improved retention, and this is attributed to the continued having the monthly Insakas that, both the negative and the positive men, they share information on the benefit of remaining on treatment. In terms of the challenges that we've had stockouts. We've had stockouts of HIV testing at our facility, and for mobile HIV testing, and usually there is this stockout that slows the work to reach out to test to more people, and also the absence of residential addresses and incorrect phone numbers in terms of the people that are HIV positive. Sometimes, the people that test HIV positive, the men, they give wrong residential addresses, or in other communities where we operate, they are slums, so they don't even have residential addresses. So it is very, very difficult to trace those men once they decide not to come. And also they give incorrect phone numbers. When you try to contact them, you discover that their numbers are incorrect. And also the Insaka venues, because these Insaka meetings, they happen anywhere. It could be under a tree, it could be in a yard of a male, it could be a school, it could be anywhere. But in terms of the testing itself, there are areas where they would want, that privacy to be there. So we have to find a place away from where they meet, where they discuss from, to a place where they could be privacy. And for the lessons learned, what we have learned is this: that integrating mobile HIV testing services and ART worked very well, because this facilitated a situation where those ones that test HIV positive, they immediately linked or initiated on ART. And then what follows is just to make sure that they are followed up for continued adherence program. And also the innovation of Insaka discussion cards helped to simplify the delivery of messages on gender equality, HIV testing, treatment, and prevention. So this innovation is an innovation that provided or provides the men with the much needed knowledge, the much needed information that finally helps the men to make a decision to begin to test, to begin to promote gender equality, to begin the treatment, and to begin the prevention journey. And also messaging on the benefits of HIV testing and treatment gives hope and resonates very well with the males. So the males in our country, they've been looking for hope. For those ones who are HIV positive, they've been looking for solutions. They've been looking for information that will help them to live longer. So giving them these messages on the benefits of testing and also being on treatment resonates very well and has helped actually to increase the numbers of males that want to test and remain on treatment. And I would also want just to give a takeaway message as I begin to conclude this discussion. First and foremost, I want to say that to achieve gender equality for women, men need to be part of the solution. Engaging men and boys is very, very important in HIV prevention and has other benefits for women as well. So this is a takeaway home. Even as we go home, we need to make sure that as we begin to program, as we continue in our programming, we need to know that engaging men and boys is very, very important in HIV prevention based on the information that I've given you, which I've presented. And also, it's not just going to benefit them; it will also benefit the women, because if they cannot um, pass on, if they respect women, if they prevent HIV, if they remain healthy for a long time, then the women, their spouses, their children will also benefit from that. The second takeaway message is this: that men causes and consequences of STIs are related to gender norms and beliefs. For instance, as a man, you'd want not to go to the clinic, not until when you're bedridden, because you believe that a man has to be strong. So that is, or you cannot go to a health facility when you have an STI because you strongly believe that it will go away on its own because you are a man. That has many consequences and is related to the gender norms and beliefs that the men have. So the moment we begin to remove the gender norms, the negative gender norms and beliefs, then we place men at a point where they begin to avoid the consequences. And lastly, through a participatory approach, it is possible to increase the linkage for men through HIV testing services to treatment. So they need to be involved. It is not just the one-off activity, then you leave them to make up their minds. They need to be supported through and through the process. They need to participate. They need to know where the health facility is so that they can begin to get the treatment. So this is where I end my presentation. Thank you very much for listening.
Thank you, Raymond, for such an insightful presentation. We'll now open up for the Q&A, and any questions that we do not get to today, we will send through the Gender COP listserv. Raymond, we had several questions related to gender-based violence. The first question is, how does the project address the issues of GBV in the home or in relationships, generally that might make women more subject to HIV transmission, as well as the reduced likelihood of seeking treatment?
Okay, this project, just like I talked about the HIM approach, the HIM approach is a very comprehensive approach. It talks about gender-based violence and how gender-based violence could be prevented in a home. And right now in our country, the statistics shows that the most perpetrators of gender-based violence are men and boys, and most of the victims are women. And it shows that actually the prevalence is very high to people that are in a relationship. They could either be married and or they could be in a relationship. So that is where the prevalence is high. So through the Insakas discussion meetings, we make sure that the men are given the benefits of not being violent. And one of the benefits of not being violent, first and foremost, is this: that the men will live happily. They will avoid being taken to the police. They will avoid breaking the family, and they will make sure that they will avoid, being jailed. And it's also a cost. It's on their time for them to be productive. So the men are given that information, and that information, is the information that when they go back home, remember I talked about the Insakas discussion cards, they place men to a point where they need to come up with where they come up with an action plan. And that action plan, if the topic was on gender-based violence, then they will come up with solutions on how they will go and not practice gender-based violence in their own homes. And we encourage the men that attend these Insakas meetings to support each other so that we don't we don't have that cycle of violence.
Thank you. And then we had some questions about gender norms. The first part is, how do you integrate social norms around gendered or intimate partner violence in your work?
Come again?
How do you integrate social norms around gendered or intimate partner violence in your work?
Okay, so we have also realized that gender norms are very, very critical in our work. And one of the issues that we discuss the gender roles that are there within the communities. For instance, the issues to do with men, we were saying men can't um, take children to the clinic, and they have to let women to take care of care work and all these other gender norms and social norms that places the women not the men not to respect the women. So what we have done is this, that just like I mentioned, that this program is a twofold program where the Dreams project is focusing on the girls, and this one is focusing on the men, and these are the partners to the girls. So the girls are also learning what the men are learning, but using different approaches. So that really works very well for us, because it provides the men a platform for them to really speak out their mind and also get solutions from other men. And also the girls on the other project, they also have their own safe space where they speak out their minds to make sure that that information has no does not really backfire. So it is integrated in the information that we provide, and it's also an issue that we have really emphasized in terms of also just making sure that the men respect the women at a home set up. They respect their relation, people that they're in a relation with. They have mutual and respectful relationships that is not abusive.
Thank you. Can you also talk about how do you measure changes in gender-related attitudes?
Well, what we have done under this program, first and foremost, we have made sure that we have a tool that we use, a community tool that we use. So, in terms of the measurements, one, we make sure that when a topic is delivered, and if a topic is on changing social norms, gender norms, we've made sure that the linkages to other services, for instance, for them to begin to test if there is an increase in terms of the people the men that are beginning to test. Also, there are also the issues to do with testing their partners, testing their family members, and also making sure that they access health facilities at the health facility. For us, we've been able to trace that change in terms of first and foremost, they did not believe to go to the clinic when they are sick. They did not believe to go with their spouses, to encourage, their spouses to go for testing or to take the children for under 5, and or just to access health services. And at the end or at the middle of the program, they begin to do those issues that we discussed. For us, that shows much of a change. But by and large, we have an activity we call the community evaluation, where on a quarterly basis, we bring in, we have community meetings where the community activist that is present, the men that are attending the meetings are also there, and also their family members. And then they talk about how intra-health using the HIM approach has changed them, and how it's also benefiting their family members. And those ones who are lying that they've changed, I think we've had situations where their spouses say, no, he's still the same man, and they need to continue being on the program.
Thank you. We have other questions about gender norms, which I'll actually save for Raymond to answer later, but I just had one last question. How do you retain men in the Insaka meetings when issues like privacy, facing stigma, and work constraints or other obligations may discourage them?
Okay, so the Insaka groups, the way we have designed them, these are safe spaces for men, and they happen within their communities. So what we have done is this, that these groups are formed, and we have contact details and addresses, and all the contact details that need to be there. So when we do the invitation to these men for them to be part and parcel of this community Insaka discussion, what we tell the men is this, that they need to be part and parcel of the intra-health group that is within their community, to make sure that we prevent HIV, we prevent gender-based violence, we promote gender equality, and for them to, begin to facilitate that change within their community, they needed to go through a process of the Insaka meetings. And we send out the invitations to those men, and they begin to come they begin to come to attend these Insaka meetings. But then what has helped them even more is the information that they get through the Insaka discussions, the effectiveness of the message, and on how they promote a health living. So it is the messaging, and also just the fact that there are men that come and sit together to discuss health issues, gender-based violence issues to do with equality, is motivation enough for them to wanting to learn more, and also practicing what they are learning in their homes.
Thank you so much, Raymond. Your presentation spurred a lot of good discussion and information through the chat room. In terms of next steps for the COP and participants, what can you do next? Use social media to spread the message of PYD. We encourage you to join a YouthPower community of practice and visit our YouthPower Learning Hub at www.youthpower.org and use some of the resources and tools that are on the website. We will also post grants under contracts, and please feel free to apply in the next round, and register on Learning Hub to share your own reports, studies, and other resources. I want to thank everyone for attending. This was hosted by the Adolescent and HIV Working Group in the Gender and PYD COP. We will send the presentation, webinar recording, and resources to the Gender and PYD COP listserv. We will also send your questions, which were really great questions, to Raymond so that he can answer them and send it to the COP with answers. We will also send a link to a survey, and we appreciate it greatly if you can fill it out. Thanks again for your participation, and we'll be ending this webinar.
Thank you. Thank you so much.